Welcome, my name is Ryan Belikoff. Today we are going to talk about Office Ergonomics. This topic is really important because a lot of us have transferred from working in the field to working in the office, and so many more injuries are occurring with these office ergonomics. One thing that might not be so straightforward is, before we use computers on a regular basis, so we're talking about early 90s, this was not a problem. People did not work in the office very much at all. So this is really over the last 2 to 3 decades that has really highlighted this problem. So office ergonomics pretty broad. There's many types of workstations. With the COVID, we had an opportunity to do a research project on where people's workstations were at home, and that they vary quite a bit. But if you look at this picture, everybody has a different scenario. Whether it's a police officer, they have to in their car, be working on their tablet. They usually have something off to the side. We traditionally think of that second picture there with the person on the phone with a big desk and the computer, but it can really vary quite a bit. So, traditionally we have something that will display on the screen, so our monitor, then we have our input for the keyboard and mouse, and then we have the documents. So, we're transitioning from paper to more digital, but even with that transition, I actually see more use of paper, and there's been lots of studies that show we actually use more paper now than we ever have. The thing that's changing a lot is the telephone. So, landlines used to be all the primary way, but now everybody uses their cell phone, even in the workplace. So that has changed quite a bit. So even though there was focus on headsets, trying to make sure people don't hold it with their shoulder up to their ear type of thing, and having headsets, we no longer have to really do that. And then we got some other equipment, so like copiers, printers, all part of the work source. And then the other one I did highlight is that lighting. So we will talk about lighting, but usually, hopefully, you have some task lighting. So, some research studies we did in Ohio looking at drone users, and they usually have about 19 screens they're keeping track of. So, quite a few screens. And what the military was investigating is the fatigue, because they're all about performing the mission. And if a drone user fatigues faster, they're not able to perform that mission as optimally. So we were really trying to optimize how that workstation can happen. And then as technology advances, our workstations get more complex. Air station controllers, for example, Atlanta Airport, they see 2,500 flights every day. So really busy. This is just an example of some screens they're looking at. They're looking at incoming and departing flights, but also the weather and all kinds of things. So they have multiple screens as well. So their workstation needs to be very versatile. So we know that a workstation, if it is improper chair, a desk, a monitor, can cause musculoskeletal discomfort. And so, along with those risk factors, we have a prolonged static postures. So they keep on saying that sitting is the new smoking, just because of how bad it is for our health, musculoskeletal disorders, but also, heart disease and those type of things, as well as awkward postures. So as far as reaching too far for an object, depending on the desk, for example. So why do we care about this? Well, since people are moving into the office, we have had different types of injuries. So these are just some cases, and we'll go into more details, but carpal tunnel is one they talk quite a bit about. And so, as you can see, we have increased cases. So 2015 was at 5,600. Now at 2025, we're at 6,600. So those cases have increased. But what I really want to highlight on each of these is actually the days away from work are getting worse. So we're not being good at identifying these issues soon enough so they can be easier addressed, as well as we're not treating them as well. So carpal tunnel, 2015, it was 28 days of work. Now we're over a month, so at 45 days away from work from carpal tunnel. So a progression we definitely need to address that. The tendinitis from workstations has not increased over the last decade at 2,600, but the days away from work have tripled pretty much. So we were 14 days away from work in 2015, and now we're at 43 days from work. So I also want to talk about, as a healthcare provider, our system is as well. Usually it takes us at least, there's managed care organizations, and could take up to 2 weeks to see a provider just to diagnose and be able. So I think that's partly what's going on with that. So if it takes longer to see the doctor, you're not doing anything. Just the whole progression is grinding to a halt, and we need to get these workers back to work. Your job as a safety professional is getting them back to work. So not only is that better for the worker, better for your employer as well. Sprain strains, a little increase here. So we got, so there's a lot of them. 421,000. So now at 2025, we're at 547,000, so quite a bit. But that's really broad encompassing. Remember, we're not just talking about upper body, we're talking about everywhere in the body. Interesting enough that this one, the days away from work actually decreased just a couple, and the repetitive motion stayed the same at 24,000. So we know good ergonomic designs and features, things like taking micro breaks, having rests, headsets, all of those are good features that reduce injuries. So we need to evaluate the system to create good conditions for our workers. So risk factors, we've talked a lot about this, but when you think of ergonomic risk factors, think of the main three. So force, repetition, and posture. So force, usually we're thinking like grip strength and how hard, but for a workstation, we're thinking about typing. And I always think about how much, some people are loud typers that are like banging on the keyboard, but ergonomically, that increase in force actually increases the risk factors. Same with the touch screen. If you have to touch it harder or longer, that increases it. Repetition. So it's definitely the case with carpal tunnel. If you increase your speed, how fast you type, you increase your risk of carpal tunnel. Other things though, it could be how much you're moving the mouse. So there's definitely features of, I've seen scrolling mouses that use your tips of your fingers and scroll rather than using your whole arm to move that mouse. So that could be part of the repetition on how much you're moving. And then posture, easy one to talk about is how we're holding our phone and talking while we're doing it. Having a good document holder can be also beneficial. So if it's on the desk, you have to, move your head more down to look at that screen and then back to the screen. So back from the paper to the screen. So those are just some examples. So as a safety professional, it comes back to the same metrics. So you want to identify, what cases are happening, what's your injury case rate, how many days away from work, those type of things. And then you want to evaluate that workstation. We'll go through an OSHA checklist. There's lots of things on office ergonomics that you can evaluate. And then controls. So how are we redesigning? So these are usually engineering controls, right? So if we have a keyboard that's more split, so we can have our elbows more on the wrist pad, that's a engineering control. Musculoskeletal issues when it comes to the office, you can go from the top of the head to the bottom of the feet pretty much. We'll go through each one of these, but neck and arm slash hand is definitely the most common. So getting into that incidence, we'll start with the top. So with the neck discomfort, unfortunately, it's pretty high. So, but it's pretty broad. Also, we got 4 to 54%. So I think the general average with this 2001 study was at 49%. So I think that's pretty accurate, is to go with that with shoulder and neck discomfort. So what the research has shown, if we have a keyboard that's above the elbow height, like this first picture here, it creates more neck and shoulder discomfort. So we want those keyboards below that elbow height or level with it. Then we got neck extension to read that monitor. This is that below topic. So this guy, unfortunately, has bifocals, so he really has to tilt his head to read that screen. So neck extension is definitely, a contributor. And then the duration. So back in the early 2000s, we were saying that studies were showing that more than 20 hours a week with the mouse and keyboard pretty much increases our risk of musculoskeletal disorders. But that has really been updated. The last one that has been done in 2017 showed just 4 hours on average actually dramatically decreases. So that's the most people at the office. And then we can look at the inner elbow angle from their elbows to go into the wrists. If it's we want it less than 120 degrees, and so that has been substantiated several times. Forearms. So we're thinking this area here. And so the incident rate has increased again. Unfortunately, 2005, it was at 1.3%. Just recently, at 2025, we were looking at 8% incidence of forearm discomfort. Again, similar studies, so then with the shoulder and neck. In 2005, they were saying 30 hours a week for this. But there hasn't been more of a recent study. So, with the neck, it was saying more than 4 hours. And I would kind of assume this is the same thing going on, especially with the increase from 1.3% to 8% prevalence. People have forearm discomfort at least 4% of the time weekly. But broadly, in the lifetime of their work, about 60% will have some forearm musculoskeletal disorder. Hand wrist. So this one is definitely increased than looking at the shoulder or forearm. So we're looking at 39% with this incident rate. So quite high. Increased incident. Again, similar thing. Looking at the duration. There's this other one with the keyboard, looking at the distance from the table edge to the J key. So how far from the edge of the desk to that middle row of the keyboards. And so if they saw that, if it's increased more than 20 centimeters, it increases the risk. So that's the other way to look at this. And my head's covering this one up, but this is for laptops. Many people, including myself and students, people in this class, will be using a laptop. And so that has much higher incidence of hand wrist discomfort at 54% here. And that was a recent study in 2025. So carpal tunnel gets a little tricky because you hear this term quite a bit. So if you see that the symptoms people are experiencing at a higher rate at 22% more recently in 2021, but actually being diagnosed with carpal tunnel actually at 9.6%. So when we think about carpal tunnel, often the gold standard is to do a nerve conduction study. So a neurologist preferably uses kind of a needle towards that median nerve from the distance of the elbow to the wrist, and they see conductance. So optimally, though, that neurologist will do it on both sides to compare it, because everybody actually has a kind of a different rate on this. But insurance gets tricky on it because usually they only want to pay for one side. So providers, end up only doing that one side. So that would help the diagnosis, as well as things that can happen is thoracic outlet syndrome. We have mentioned this before, but compression up here can affect the hand down here. Way more common of an injury, but people don't know about thoracic outlet syndrome. Um, and so that's one reason. So the really paying attention to those symptoms can, be beneficial. So that carpal tunnel, remember that median nerve feeds the thumb, the index finger in this area. So carpal tunnel should not be the whole hand. It should only affect towards the thumb here for numbness, tingly, shooting pain. Excuse me. Again, same incidence, duration of more than 20 hours. But the only difference on this one is they really like is the arm and wrist being supported 50 to 100% of the time. So without that, then the increase dramatically went up. So, we've talked about sprains, strains, so this is just getting more particular for that tendonitis, tendinopathy. So, this novial wrapping, you can get inflammation, so that's that itis. Incidence of 20%. Again, one of the things the researchers looked at is the distance from the edge of the desk to that J key, seeing how far they're reaching and actually moving their arm. The other thing that's a little different on this is the radial deviation. So radial, remember, is thumb going inward, whereas their ulnar deviation is this way. And so more than 5%, it was not very good. So you ideally want the hand straight. So we've already talked about static posture. This just goes to show for the static posture in the Office Ergonomics. So it increases intramuscular pressure, but decreases the blood flow going to the muscles, therefore decreasing the nutrients that are getting to those muscles and reducing the waste that can be carried out, all resulting in more fatigue. And if it continues, it's going to happen in injuries for musculoskeletal disorders. So other physical stressors I want you to think about is that sustained neck posture. If you're keeping that neck in the same spot, same thing goes for repetition with the keyboard, how much you're typing, and then what kind of supports do you have. So, my mouse pad has a little pad for the wrist to relax on. Same with the keyboard for your wrist to relax on. So without these, you're decreasing your level of discomfort, increasing fatigue, increasing pain, decrease in productivity, and possibly the worker has to miss work because they're not able to work. Other avenues, so oftentimes we get so wrapped up in a biomechanical piece Psychosocial, just as important. So when a person feels like they have lack of support, um, you know, rigid procedures, so they don't have flexibility, they don't have support from their peers or management. Usually, all increases, we've seen an increase in work comp cases, and usually more absenteeism from work. So we talked about ways to support that risk through the mouse keyboard or even the or the mouse. But other things we can look at is actually separating that keyboard a little bit out to prevent such deviation in the wrists. Other control strategies is increasing the chair of the height of the chair, so you don't have to have your elbows flexed as much. We've already talked about split keyboards, but there's definitely alternate mouses. Some of them that you're using mostly your thumb that has a ball on there, but they saw quite a bit of increase in wrist pain or thumb pain. So anytime you add a control, you gotta look at the pros and cons. So other issues, so we mentioned the padding, but the continuous pressure on the surface, especially soft tissue, decreases that blood supply, uh, decreases the waste going out, all of those issues. So, controlling those hard edges and corners are very important for that stress contact. So most of you are young, but eye strain, whether you're young or old, is an issue. How long you look at a monitor, for every hour you should be taking a break and looking out in the distance to actually relax your eye muscles. Remember, your eye muscles have muscles on the lens that flex. And so you can, fatigue those muscles. We often take our eye muscles for granted, but this is one example. So ideally, we want to be at 20 to 40 inches from the monitor, from our tip of our nose to the display. And then, I already mentioned looking at objects in the distance. So all of those things can help. We're going to talk about also glare from the monitor, things we can do. But this is a really common reason for headaches. Tension headaches are usually the top of the head, being that awkward posture. But vision speaking, especially migraines, are very sensitive to light. So lighting requirements, especially more of an issue as you get older. So, if you have workers that are 40 plus, you need to think about how bright the workstation is. So they require about 35% increase in brightness for several reasons. So they're not able to flex, their lens as much, but also those cones and rods are decreasing their percent. So all of those are affecting their ability to see detail in dim light. And then at 65 or older, twice that brightness than when you're 48 years of age. So those are very important things, and it's just a natural occurrence. Generally speaking, no matter what the age is, you should have about between 250 lux, they say. So to put that in, more of our light bulb situation, we need about 150 watts of in a 10 by 10 room. Oftentimes we don't, we have about 80, so this is a good example where we could use task lighting, low lights at each of the desks. So universities used to be really good about this, having them in the libraries, but I've seen a dramatic decrease. So it's something to think about to help your eyesight so your eyes don't get fatigued so quickly, and you can study longer and more productively. All right, workstation issues. So glare, oftentimes if you want to, have any computer workstation next to a window, you want to have some glare. So direct glare is the light source that shines directly into your eyes. So this could be the light shining into your eyes directly, but indirectly is the sunlight coming in, bouncing off that monitor into your vision. So that could produce this top right where a lamp or the sun is producing a blur. So things we could do, we could put little screens over those monitors. Not as common. Curved monitors is more of a new thing, and that it could be a way as a control strategy. But also that task lighting can affect how much lighting you need it for in general, and affect that indirect glare. And then, of course, you can treat the windows. You can have tint on that window. You can have, blinds, all kinds of stuff. So indirect lighting, usually from that overhead light. So this example on the top right, they have indirect lighting bouncing off the ceiling, lighting the whole room. And the good thing about this is it doesn't produce glare, but usually less bright. And then task lighting, so we got little lights at the desk here, illuminate only certain objects. So if you're doing really detailed work, so I just got back from a work ergonomic evaluation, and they were grinding, but they had to be about 1 foot, and they had to be millimeters, so really detailed work. So this is an example where task lighting can be very beneficial. So again, different types of lighting. We have the overhead. The good thing is that produces low glare, but not as bright. We have indirect lighting. A direct light could be just from the sun coming into the room. The screen itself produces lights into your eyes, right? All of the areas of where lighting is what can happen. Oop, sorry, didn't realize. Workstation issues, corrective lenses. So we've already gave example of a bifocal where they have to tilt their head so they can see that certain distance rather than normal is just seeing far away. Definitely people with bifocals, I hear all the time where they have neck discomfort because they have to move their head more. So something to think about for your workers that have to use these. So maybe having an adjustable station where the workstation tilts rather than them tilting could be a way to address this. So adjustability is key. Remember, we want to fit that workstation to the worker. So whether you're lifting or in this case typing, it's all the same. So maintaining a posture at long periods of time is stressful. So posture changes encourages blood flow and reduces fatigue. Oh, but the components must be properly adjusted. So I see this quite a bit with chairs. So there's all kinds of fancy chairs, but if you don't know how to adjust your chair properly, it's not doing its job. For example, the elbow rests. There's lots of adjustability, but really you want it level with that workstation. So when they go to the keyboard, it's slightly down. So people don't usually address that, just the rests. They just come with how it is standard. So some things to look at the workstation. We talked about quite a bit here. So that viewing distance is probably the easiest, straightforward one to go right to. Level with our eyes should be at that top of the screen pretty much. Document holders, ideally they'd be nice and center, but usually they're off to the side. Looking at The keyboard height, we want that nice and level with the elbows. So therefore, when we use our hands to keyboard, it's actually slightly down or level. Then we got the chair, so we have a backrest. So ideally, we have a backrest to keep that worker nice upright. Rests, elbow rests holders, we want the elbows resting so the shoulders don't have to hold them up. Knee height from the thigh, we want that level with the ground, ideally. So the worst case scenario is actually for them to flex more, so meaning that the chair is too short, and that would bring those legs up. But ideally, we want that level. Same with the knee angle, we want that straight up and down. So if the person's not able to rest their feet on the ground, a footrest, we don't want those feet dangling because it puts pressure on the back of the knee, doesn't allow that blood flow back up to the heart very well. So all of those are characteristics we can look at with a workstation. Checklist is usually the most beneficial because it's easy to miss some, because I just see right here, oh, I missed the wrist, so we don't have that direct contact pressure on the wrist. So lots of areas to evaluate. Knee clearance, we don't want those knees rubbing up against the desk because, again, other contact stress. Pan height, so for pan for the chair, we can have too big or too small. Ideally, it fits the pan your body width perfectly. All right, so three main links between a person and their job. So we got the visuals, so which is that screen, and things that are connected to that is the import source of the keyboard and the mouse and the document holder. And then we got the leg support, so we can have foot rests, arm rests for the elbow, wrist rests. So lots of body support, manipulation, and the visual are all three main links on trying to design the best workstation. So chair, I already mentioned adjustability is key, but using it right in the chair is probably the most common one not to adjust right. So this is a easy one to go right to. So the height of the chair, to make sure their legs are not dangling here. The waterfall seat edge. So ideally it's level with the ground or slightly down, again creating a gap behind the knee and the thigh. Seat pan width and depth that you can look at to fit that person to the body. We're all different shapes, right? So this is where proper seat for that person. Lumbar support, so ideally it would curve slightly in with the lumbar, because a lot of times those back edges are nice and straight, but the lumbar curves inward, leaving a gap. So ideally we have a support with the lower back. Looking at the tilt, so this is one where I often tilt back, but we want it ideally upright, straight up and down to keep that worker as upright as possible. Backrest height, ideally it should come up to the mid back or a little higher. Arms, so the arm allows for elbow rests right here on the H. And then a nice strong base, we have 5 casters, which is the most standard. So again, this is just a picture of that pan, since I had on the side angle, just to give an example. CIH exam, usually they talk for Office Ergonomics, they like to talk about what is the seat pan width, and that can be confusing if you're not used to that term. So it says that seat pan depth should be enough that the front edge does not press on the back of the knees again. Height adjustability, so you know your feet are not dangling, creating that good 90 degrees with the hip and the knees. And the adjustability is based on what kind of task you're doing. Backrests, we've talked about this, how we want good contours to support the contact with that back, whether it be the lower back, mid back, or upper back. We just want good contact, supporting it and allowing those muscles to relax. Armrests. So ideally, those armrests are the elbows can rest completely on those armrests. So most of them should have adjustability because we're all different torso distances, and that's going to affect how our arms rest. So looking at adjustability with these armrests. And then footrest, especially for people that are a little bit shorter, those chairs don't go low enough, or the workstation doesn't go low enough, which is more common. I definitely see this with people in the medical field, like pharmacists. Usually they have more of a standing and higher counters, and so people don't have rest for their legs. But having a chair that either has more of a stool for their legs to rest on, or we have these footrests that you can do on a normal workstation. Keyboard support. So a lot of times I see keyboards underneath the desk prior. Not as common anymore, but they allow that good distance, so those elbows are not above the workstation, increasing risk. So this would be a way to do it. The bad thing about keyboard supports is a lot of times they'll have contact with the thighs, so we don't want that. Monitor, for ergonomic office design, this is probably the first one that you'll go to right away. So is that top of the eyes on top of the screen type of thing, or slightly below 15 to 20 degrees below that horizontal sight. So having a monitor that adjusts, but also you should have a primary. So this is really common in the IT field to have two monitors, but it will be split in the middle, so they have to turn their neck each way to look. But ideally, you have one primary and then a secondary off to the side, so you don't have to move your neck as much. Headphone sets, I don't see this as much anymore, especially with cell phones. Usually we use quite a bit of speaker phones. But before that time, definitely a lot of neck pain just because of awkward postures holding that phone. Document holders, there's all kinds of ones that are off the monitor or off to the side. Again, if you have that piece of paper on down flat, you cause quite a bit of neck flexion and rotation just to look at that document. All kinds of ergonomics designs when it comes to mouses and keyboards, so we've pretty much talked about them. The split one is probably the most go-to for me. For mouses, this is kind of a tough one. So I've tried these balls with the thumb, and they cause quite a bit of thumb pain for me. So I don't actually like them, but something to consider. But also the mouse size can definitely make an impact. I'm that small guy, so a small mouse actually really cramps up my hand. So something to consider. OSHA office checklist is probably the most common. We'll use this to evaluate the workstations. Your assignment is to evaluate 3 workstations, and so I want you to use this OSHA checklist as well as a chair evaluation for both of those. Ideally, a part of that assignment says take your symptoms of the patient. This can really cue you in before you evaluate that workstation. Ask them how their workstation is working for them, or if they have any symptoms, and that could really clue you in to things that you need to focus in on. So this is just an example of that OSHA checklist. Um, and just yes, no questions going from the top of the head downward. It says, all right, is the head and neck balance in line with the torso? So we see this line, that back of the chair really indicates, is that shoulders level with the head? On this one's pretty good, right? Head and neck facing forward. So um, Michigan had this, they were evaluating ergonomics, but it was just the camera straight ahead. And so they were saying yes, no, based on their posture with this one camera. But posture, especially with the ergonomics, is usually coming more to the side, evaluating how much of their lineup is with each one of these. So both views are important, but they were basing good posture just on one view, and that's definitely incorrect. Dorsal is vertical to slightly inclined. Dorsal is vertically and slightly inclined for good postures. On this one, I would say yes. Back is fully supported by that lumbar support, and I would say yes on that one too. Shoulders are relaxed, not elevated, so you can see they're not bunched up. I would say yes on this one. Elbows are close to the body. That one's hard to view with this one view, so ideally you would get other view on the side. And I don't know if I would mark yes or no on this one just based on the one view. Forearms are approximately parallel to the floor. I would say yes on this one. So you see the armrest and the keyboard is slightly below. So at that 90 degrees, so that's looking good. Wrists and hands are straight, so that wrist is pretty straight, so yes on this one. Shoulders are relaxed, again, same, yes, doing good on that. Thighs are parallel with the floor, so you can see this, the pane is at 90 degrees, parallel with the floor, so yes on that one. There is sufficient room under the work source, so their thighs are not contacting. This one's hard to say. I would say no on this one because I think there might be a little contact right at that edge. Where the knee is, no, but where the top of the thigh, I would say yes. So is there sufficient room? No. Legs and feet have sufficient clearance, so their knees aren't contacting. Their feet look like they're on the ground. Sorry, I have to look. So yes on that. Feet are flat. Yes. Sharp edges of contact of the wrists. It looks like the keyboard has a pad. Unsure about the mouse, but I would say yes on that one. All right. So backrest has a height adjustability. It looks like yes on this one. Chair has a sturdy 5-bit base, yes. Seat width and depth, so we can see here it's sufficient, so yes. Front, the knees does not press against the back. I would say yes. Seat is cushioned and rounded, no with a waterfall front. Hard to see on this view, but if we went back, I would say yes. Seat height is adjustable and allows for proper adjustment. We see these 3 levers on the seat, so yes. Armrests they do have, and they were supported. You can see if it's too high here, how those shoulders are hunched. So even if you have elbow armrest, you can easily evaluate it by just looking at the shoulders. Headrest, if provided, is adjustable, so no headrest on this guy, no. Casters are appropriate for the floor. On this one, it was a solid floor, so yes. Adjustabilities are straightforward and easy to perform. On this chair, which is different than the chair before, but this one, 3 levers I think are pretty straightforward. On here, the adjustability, there's a button for the armrest right here, so yes. Okay, so other things we can look at, keyboard adjustment, is it large enough? And so I mentioned, I have a large hand, so I need a normal size mouse. So those laptop mouses are really hard on my hand. So on this one, good. On the second one, we have, surface contact. So that's bad, so that's no. Can it be adjusted on this guy? So no on here. Input, does they have a mouse that has a tracking ball or allows them to scroll? And yes on these, the top and the third picture, but no on the second one. All right, so continuing on the inputs, input is easily activated and the shape fits the hand. We already went over that, so that's a yes. Input device is located close to the midline of the body, yes on that one. It's not a touch screen, so NA on that. There are no sharp edges. There is a sharp edge. We got contact. So a no on that guy. Monitors, is there sufficient adjustability so the top of the screen is at eye level? It's pretty much a yes on this one. Our minimum is 15 degrees, and so that's where they're at, so they're okay with that. And their distance is 30 inches from here to here. Remember, we have a range of 20 to 40 inches. So both yeses on the top 3. Last one, monitor position is directly in front of the user. Yes. So if multi-monitors, is there a primary position right in front? So this is an NA on this one. Color from Windows, there's no Windows, so NA on that one. Monitor brightness and contrast, hard to say without being there. And then we have some accessories. We're looking at the document holder. Is it large and stable? So on this example, yes. Is it placed about the same height as the monitor screen? The top one, yes. Bottom one, no. Wrist padding, keyboard padding, no on this bottom one. Telephone NA, telephone NA, headset NA, footrests, NA on that as well. Then we just got some general checklists. We pretty much have went through this of talking about adjustability and accessory items. So just a little bit added to this one that asks like computer tasks are organized in a way the user can vary the keyboard within the activities. So think about if you have to write some items, do they have to twist to write them? If they don't have to write, then you don't have to evaluate this. Unfortunately, keyboards are often primary use, so this is kind of evaluating phones, keyboards, tablets. So this is a really straightforward checklist. Is there a separate input? My tablet have a Bluetooth keyboard that allows me to type rather than pushing it in. Are laptops used outside of the office? For ergonomic evaluations, I have used tablets in the field that had to put a lot of information, and so this is an example where the software as well as the hardware needs to be well done. Laptops used in vehicles, went to the mine recently, and sometimes they have to use tablets. Um, all the police force, they have, a workstation built into their car because they're using them frequently. And smartphones usage that, evaluating, are the shoulders relaxed, are they positioned near to the torso? That's where those little gadgets in the back of the phone so you can hold it um, without as much contact stress and force. So I mentioned, part of your evaluation for your assignment is asking symptoms. So this can be very important. Um, just recently I had a graduate student evaluate a workstation. I said, did you ask their symptoms? No. So they went back and they're like, oh yeah, I have lots of neck pain. And he brought out his, bifocals, and the, student didn't even know that he had bifocals because when he came to this office, he wasn't wearing them. So, these are areas where you can really expand upon and give good recommendations. So things to ask, before if you're given the survey, is before and after your work, these symptoms, how much they're having these symptoms, and how long they're lasting. Of course, easy tips for office ergonomics, micro breaks. So it's easy to stay in one place for hours and hours at a time. At the end of the hour, encourage people to take a walk, whether it just be a drink of water, go into the bathroom. You could do 30 seconds to a minute stretches or brief exercises. Wall angels is a really good one. So ergonomic solutions don't have to be costly. Look at the low for hanging fruit. With that example of that student evaluating with their neck, really they just needed to increase their monitor height, which was adjustable, and that they end up adjusting the height and putting a book underneath. Other exercises you could do at your workstation, so you don't even need to go anywhere. Rolling the shoulders, stretching the neck off to the side. So this is an example of 12 easy exercises, but really the standing one, just getting the whole body movement, is really important. So easier solutions, we got down here in the bottom left corner. If that person is smaller and they're not having the good contact, you could just put a cushion, fold up a towel or something like that to create that cushion for them. These top two ones on the left, instead of a monitor that doesn't adjust, putting something underneath to increase the height. So the top of the eyes is at the top of the screen. Contact stress. If you don't have a keyboard that has a nice cushion, those could cost $20, $30. So this is a little noodle that costs $5. Or an insulation one costs about $2. So an easy one to put on the corner of the desk to minimize that contact stress. So always encourage good habits. Laptops are probably impossible to have good ergonomics. So as you can see with the people sitting, especially at the couch here, is that good office ergonomics? No, the neck has to bend quite a bit to see that screen, right? We want that monitor at the top of the eyes. The elbows are really close together. They want to be above that elbow distance is going to be quite flexed above, not level at all. So, and then that they don't usually have a mouse, so they have to keyboard more. So lots of issues with, laptops and tablets. All right, so we're going to go through about 4 or 5 workstations on each one. I want you to pause and kind of evaluate what you think. So this guy has a laptop. It's not, the primary is not in front of him. He does have 2 monitors. Notice they're both off to the side, so they probably have to, turn to be able to use. Um, he does have a piece of paper in front of him. So this is asking him, is your primary work, writing or is it typing? And it's probably typing, even though his primary station's made to more write. Making those adjustments. Neither of these screens are straightforward, going right straight ahead. He does have lower back contact. It looks like the legs are doing okay. And not contacting with the desk. So those are just a quick survey. Going to the next one, it's a little bit more closed in. There's 3 screens on here. So asking her which one is her primary. Ideally, all of these screens again need to increase in their height. And the keyboard from the edge of the desk to where her keyboard is quite far away. So remember, we want that 20 centimeters. This chair is a little bit larger, so giving good contact. But again, we can't really evaluate that keyboard distance. I assume she's using the first one, which she would have to bend her elbows quite a bit. Again, the laptop's bad. Elbows flexed, top of the screen. This guy has to really bend down. The chair is bad. He's, has to bend his knees, contact stress with his legs, and back not being supported. So a lot of issues with this one. All right. So this one's a little bit better, harder to evaluate. But the immediate thing I go to is this chair. His back is not being supported very well. The screens are a little bit better, but all of them could be increased by at least 2 inches probably. All right, so this one, the keyboard is much better, still using that laptop. You can see all these problems. So this is probably a much better solution to this laptop because our keyboard is external they're using so they can keep those nice and flat. But her contact with her chair is not very good on this one. I can see a gap with that one. At least we got that 90-90 with the hip and knee. Still could be increased with that monitor height. She is closer to that monitor, right? We want that 20 to 40 inches, and I think she accomplishes it on this one. Okay, so a lot of these, as you can see, they're not having a good chair contact with their neck rests. So quite a bit of ulnar deviation with their elbow off to the side on this one. At least it's downward, and I don't see contact, but her feet aren't straight on the ground. Um, Again, this monitor and this monitor need to be increased to that eye height. Pretty much the same thing goes for this one. All right, giving you a moment. We'll go ahead and pause. So what I like about this one immediately is they're trying to move a little, right? We have sit down and standing apparatus that when they're standing, this is usually a problem with standing. It's hard to adjust it, so it's good. Notice that they're using the books on their keyboard to keep their wrists nice and straight. So it works. Top of the screen is with them, so that's good. They're using a footrest, which is great. Their back is contacting with this backrest is contacting with their back. So all in all, not too bad on this one. Okay, these are more new progressions, people working. I would caution people on this one. What new studies have found is people are less productive actually trying to exercise while they work. They're much better doing one or the other. Um, I would like to see a little bit more research on this, but that's what the research has shown so far. All right, so that concludes our office ergonomics.